huge things are happening under the surface that people don't understand. So for instance, let's just look at the doctors, because I think, you know, what the patient says, what the individual citizen says is, when I get sick, a doctor is going to take care of me, and I'm so glad for the American healthcare system because it's there for me. But they don't understand that the power of the doctor is being subsumed by the government. The government, in concert with the health plans, are moving together to take all power away from the doctor, and then, of course, as a matter of fact, that happens to the patient. All power is then taken away from the patient. And suddenly both the patient and the doctor can no longer do what the patient needs, but only what the outsiders tell them that they can do. And yet from the outside, it looks like the patient's going to a clinic, there's a doctor at the clinic. They don't realize the control that's happening through the electronic health records. And that's really where all the power is. So when I said, you know, we look at privacy and we do a lot with privacy, it's about maintaining the doctor and the patient's control over the data so that the patient can be taken care of as the patient needs to be taken care of. I say that we are moving from the mission of medicine to the business of healthcare. And you can feel that when the first thing that happens when you come into the clinic is they say, "Can I have your insurance card?" They don't say, "Mrs. Jones, how nice to see you." They say, "Can I have your insurance card?" And it's all become very sterile and clinical and impersonal and unfriendly. And that's because of all the regulations and all the administration that has been pushed in since the HMO Act of 1973, when we started to remake the healthcare system in order to try and get a handle on Medicare. So this move from the mission of medicine, which is where medicine started. The only reason we have healthcare is because we have a patient in need. So we're moving from that charitable system to a very impersonal, business, cold, calculated system. We need to have a healthcare system that's about patients and doctors and freedom, and that's at the pocketbook level, which is where it would go if all of those third parties, for the most part, are out of there, and insurance becomes insurance again. And first dollar minor routine care is actually paid for by cash. And we see this happening around the country in the cash-based practices. And when I say we need a wedge of freedom, I mean we need to protect cash-based practices. We need to protect the ability of a patient to find a clinic without an electronic health record so that their freedom is protected by privacy. In case nobody figured that out, freedom is protected by privacy. So we need this wedge of freedom into which more and more patients and doctors will come, and the wedge will grow as the people out here go, "Oh my gosh, I'm not being taken care of and nobody cares about me. Where can I go? I'll use my own money." And they'll come into this wedge, and we will build a system again of health freedom by building the wedge.
What are doctors doing in the face of all these changes?
Well, I think doctors are experiencing perhaps an ethical dilemma, because the doctors are required by their Hippocratic oath to do no harm to the patient. They're required to keep confidences between themselves and the patient. And they know that the only way that they're going to get down to the facts of what's happening to the patient is if the patient feels like the clinic or the exam room or the bedside is a confidential place where they can have a confidential conversation. And doctors are now being told by the federal government through the 2009 HITECH Act and through Obamacare and through Medicare that they have to report patient data to the federal government. They have to have electronic health records in order to be paid. And now with the latest DocFix bill, they will choose between two different methods of payment. And those methods all require them to submit all of this data to the federal government for the government to decide whether they're a good doctor or a bad doctor and whether they will get more payment or less payment. And so it becomes a very difficult time, I think, for doctors who know that they aren't supposed to be doing this, but the federal government is forcing them as part of the movement to a national healthcare system to report all of this information on the patients so that the outsiders, the doctors and the outsiders, the health plans in collaboration with the federal government can start to constrain and restrict the hands and the medical decisions of the doctors.
You just said something about changes in the doc fix. Say more, because I thought that was just fixing a reimbursement formula that the Republican Congress just did with President Obama. What else was there?
Well, the doc fix bill was actually a 323-page bill. So it did more than repeal the sustainable growth rate, which you're talking about, which everybody wanted to get rid of. Well, and it's a fine thing to get rid of something, but it's really not fine at all if you put something even worse in its place. And I think it was the Medicare actuary that said that on a payment basis, doctors are going to be even worse off in the future than if they had had the 21% cut through the SGR. So, and as far as I know, Congress knew what the Medicare actuary said, but just passed it anyway. But that was only a small part of the bill. The other part that I think is really concerning is the fact that doctors get to choose between being paid called an alternative payment system or MIPS, the merit-based incentive payment system. And so if they do the MIPS, they have to report on how many resources do they use to take care of patients, right? How much money do they spend? How many treatments do they give, right? And what's their clinical improvement activities that they have been a part of? And do they use an electronic health record? That's 15% of their score, if they use one. So this is even more to push them into violating the patient-doctor relationship. And what's the value of the services that they give? The value. Who gets to decide value? Well, it's not the doctors and the patients. It will be outsiders deciding value, and that's 30% of their score. So that's MIPS, and the other one is the alternative payment system, which means that the doctor would group together with more doctors, essentially become a group, and they would receive from the federal government a lump sum annual payment, out of which they would divvy out the money across the entire year to their entire patient population. Now, pity you if you have a significant and expensive condition and it's November or maybe even September, because those doctors aren't going to get paid any more than that lump sum, no matter how expensive you are. So throughout the entire year, they're going to look at every patient with an eye towards, will they have any money left at the end of the year? Because if they do have money left, they're going to be able to keep it. So now what we have done is we have set up a conflict of interest between the patient and the doctor, where if you are an expensive, difficult, or complex patient, you're going to be looked at as a burden and perhaps a threat to the practice if they are on this lump sum payment system. So the government has set up something very clever here in order to save money, but they are destroying the healthcare system and the confidential patient-doctor relationship required to have the excellence in medicine that we have today. So you can see perhaps the danger in the doc fix bill. Really wasn't a doc fix bill at all. It was really putting the doctor and the patient in conflict with each other.
So based on what you're watching, Twila, explain, what do you see happening with Obamacare as it's rolling out?
Well, interestingly enough, I think that Obamacare in the minds of the American people is probably mostly the exchanges and the insurance and the subsidies and the lawsuits, and I look at it more broadly than that. And so I'm seeing the impact underneath the surface. I'm seeing the impact of what's happening to doctors, what's happening to patients. A lot of people say, well, you know, Obamacare has no impact on me. And I say, you just don't realize. And maybe it's much more, maybe people can think more like Canada. In Canada, the majority of the people say that they like their healthcare system because for them it's a security blanket. And they say, well, when I get sick, it'll be there. But the majority of people aren't sick, and so they don't experience the healthcare system, except when they're very vulnerable, very much in need, and very unable to help themselves. So, for instance, I would one of the things that's happening as a result of Obamacare that people totally do not understand is that we no longer have health insurance in America. I just want that to settle into your brain. We no longer have health insurance because health insurance is to take care of catastrophic events. If you have health insurance for your house, it's not when you need to paint your house. It's not when you need to fix the drain or fix something in your house, right? It's not even to put in carpet. House insurance is when the fire comes and destroys. But what Obama said and what Obamacare requires, if it were for house insurance, is that while the house is burning, you could go to the homeowner's insurance company and say, give me insurance. Because what Obamacare says is that everyone must be covered regardless of your health care conditions. This means that it's not insurance anymore, because insurance is about covering for the condition you don't have yet. For a house, you hope you don't ever have a fire, so you get home insurance just in case you do. For health insurance, you hope you don't ever have a catastrophic condition, but you get health insurance in case you do, because it's a financial insurance plan. You don't have enough money if you have a catastrophic condition, so you buy insurance. But Obamacare says that everybody has to be covered no matter what, no matter when. And therefore, we don't have insurance. We have moved to third-party payment for health care. And that's the way you get to socialized medicine. That's the way you get to government-run health care, when everyone is just covered and there's a third-party payer.
But didn't we have that with insurance before, third-party payment? So what do you see as a practitioner in the field, really, between government versus insurance being the third-party payer?
Well, one of the things that Obamacare did is it said we could no longer have catastrophic coverage. All of catastrophic coverage was gotten rid of, except that Obama made that getting rid of that a little slower. So there was an exemption, so people were allowed to keep their plans after a while. When things got going and got tough, Obama said, okay, if you got a plan, you can keep it for a while. And so there's still some catastrophic coverage today, but really the law, when you look at it, says that the only people who can have catastrophic coverage are those aged 29 and under. And so everyone else has to have managed care. So Obamacare is really about bringing in the health plans as collaborators with the government to run a healthcare system that covers all expenses from the first dollar to the last, and then calls it private coverage. And it really isn't, because Obamacare is really about taking over the insurance system and moving us to single payer without it looking like it, moving us to government healthcare without it looking like government healthcare.
And how was it sold to America fraudulently?
Oh, and I think so many ways, right? You know, if you like your plan, you can keep it. If you like your doctor, you can keep it. I'm sorry. If you like your doctor, you can keep him or her. Everybody's going to have coverage. Coverage is going to be less expensive. Families are going to pay $2,500 less in the first term. You know, there are so many things about it. The access is going to go up. The cost is going to go down. The quality is going to be wonderful. And of course, that's not it at all. It's a complete destruction of the excellent healthcare system that we had.
You are the only one I've heard talk about a DNA issue with newborns. Say more.
Yes, this is what I consider sort of the silent secret issue happening at every state. And when a child is born, the hospital staff comes in and they prick the baby's heel, and they have a special filter card, and they let the blood drops go onto this special card. Now, parents think that this is just part of what is happening with their baby at the hospital, and that it probably goes to a hospital lab. But it doesn't. It goes to the state that they're in, so this public health laboratory of the state that they're in. Well, this has been going on since the mid-60s. And it used to be just one little drop of blood here on the card, but now we're up to 5. And why are we up to 5? We're up to 5 because the states realize that DNA is a very valuable property, that this child's blood is their DNA, and that they can take it at birth and keep it at the health department, because newborn screening, this is the newborn screening process. Newborn screening is done on every baby at birth. Parents all think it's being done by the hospital. A lot of parents don't even know newborn screening ever happened. But that child's blood is then sent to the state, because newborn screening is a state government program. It's considered the largest genetic testing program in the country. And parents are clueless. They have no idea whatsoever. Along in the 90s or so, late 90s I believe, people started realizing at the state level that here were the child's DNA of every child at birth, and they should maybe keep it. So they went from one blood spot to many more, and they are now keeping the child's DNA in different states for different periods of time without the parents' knowledge, and conducting genetic research without the parents' consent. And some states like New York, I think, keeps it for 27 years. I think New Jersey, it might be at Indiana is at 23 years, although they just changed their policy. California is in the 20-some years. Some states are indefinite.
So who has access to the DNA then?
Whomever the state decides to give it to. So it could be just that the state government itself is doing research. They might be giving it to corporations. They might be giving it to researchers around the country, around the world. There are 4 states that are in a virtual repository. So the federal government has set up a virtual repository of newborn DNA, where they let researchers come and the researchers say, these are the type of characteristics that we're looking for, and where can we find DNA from babies that have these characteristics. And I can't remember if they have to pay to get that DNA. They probably do. But those states that are in the virtual repository are Michigan, New York, Iowa, and maybe California. I can't quite remember. But there are 4 states, and I think that there will be more because of our recent federal law that I think will encourage more research and will encourage more states to make their children's DNA available in this repository.
So talk about the privacy issues, that if you had everyone's attention, what would you want them to know about privacy in healthcare?
Now, I think that a lot of people say that what's in their medical record is not private. They have nothing to hide. And I would say that the biggest thing about privacy is not privacy itself. It's about control. He who holds the data makes the rules. So when it comes to privacy, yes, there are people who have things in their record that they really, really are private. They're very sensitive. They never want anyone to know. And they need the hospital and the doctor to be a safe place for them to go to say these things that they have to say in order to get taken care of. But they really don't want anyone else to know. So when it comes to privacy, you need privacy in order to have that kind of interaction with the doctor. So you can speak frankly to the doctor, and so you can get the care that you need. But a lot of people say, I don't have anything that's private. So then for me to get them to understand why privacy is so important, I have to tell them about why everybody else wants access to their data, to their private data. And that's because he who holds the data makes the rules. If the outsiders have access to all of the information in your private records, including where you work and how much you weigh and what your BMI is, so they know your obesity level, right? What drugs you take, what comments you made to your doctor, what's your family like, what's your behavior like, do you exercise, don't you? They can profile you and determine whether or not you're the type of person who should have this type of health care or that type of health care. Or maybe your life is not disciplined enough, so they won't give you this type of health care. You can only have this type of treatment. And so that's one angle of it. But they're also going to profile your doctor. And they're going to look at the decisions that your doctor makes. And Obamacare, as well as Hillary Care, are all about moving the doctor under the control of outsiders. And the only way to do that is to look how the doctor treats the patient. The only way to look at that is to look at the data in the record and start tracking the doctor and tracking the patient. Here's an example. Let's just say that your BMI is too high according to federal statistics, right, or federal guidelines, and those are all whatever the federal government wants them to be. So they can make more people fat over time as they want to change the statistics. But let's just say that you are. And then you get these questionnaires at the doctor's office, which, by the way, we always tell people really not to fill out, but most people do. And so they'll answer questions about exercise and how much they exercise a day, or they might answer questions about television use or computer use, or how often they drink or how often they smoke, or they'll answer all these kind of behavioral questions. And suddenly this person who is slightly overweight wants a particular procedure. And the doctor and the health plan and everybody else in the back room is looking at what this patient does, and they're saying, no, you can't have that procedure because you'll never exercise enough to make it worth our dollars to give that to you. Or you'll never control your diet sufficiently, that would be a waste of our money to give this procedure to you because you will never control your eating. And so we're not going to. And so for us, it's not medically necessary for you to have that procedure. Of course, I think if you look at smoking, and if you've tried to stop smoking, or you smoke too many packs a day, or you've got smokers in the family, and you want perhaps a cardiac procedure or something like that, then they'll look and they'll say, you're 70, you're 75, you're still smoking. Yeah, we know that your heart or your lungs are kind of under stress here, but well, how much life value do you have at this point that we should put all this money into you when we could give all of these children immunizations, or we could give a cancer treatment to a child, and we as the health plan will balance this and say, at 75 you lose in this balancing equation. Psychiatric care from the perspective of privacy, this is where I think once people realize how they don't have any privacy in their medical records anymore as a result of HIPAA, as a result of the HITECH Act with the mandate for electronic health records, I think as people realize that, they will start choosing their words very carefully. And if you are a patient who has any kind of psychological problems, any kind of emotional issues, any kind of family issue that requires a conversation with a counselor, you're going to think twice about actually making that appointment, because suddenly the doctor's office, the clinician's office, the psychiatric office is going to feel unsafe to you. Particularly if you see your psychiatrist clicking away into a computer because they have to enter data in order to be paid, or they have to enter data in order to prove that they're a quality psychiatrist. And so they have to enter all this information on you, and you start to figure out that, whoa, this data is not just within my four walls. That I'm having this conversation, this data is going out to who knows where. And the reality is that who knows where includes the potential of more than 2.2 million entities being able to access your data without your consent, plus all the government agencies. And this is as a result of HIPAA. And I think that people don't understand that HIPAA doesn't protect privacy. It opened up your medical records. And when I say 2.2 million, people are going to go, oh, where'd she get that number? Well, I got that number out of a 2010 federal rule where they actually listed all the covered entities that could potentially have access and all the 1.5 business associates. And then government agencies aren't part of either of those, but they have access under the national priority purposes that are part of HIPAA. So this is a reality that today, because of HIPAA and because of the electronic health record mandate, most people don't have privacy.
So what do you encourage consumers and doctors to do in the face of the realities that you're describing?
I think this move to the idea of consumers is more of a move to take the patient-doctor ethical issue out. And it's really about patients and doctors. And the only thing that you're a consumer about is buying a health insurance policy. But really, the only reason you buy a health insurance policy is you hope never to be a patient, and if you are, that it doesn't bankrupt you as a result, and so you buy insurance. That's the whole thing. The only reason you buy insurance is because you're afraid you'll be a patient. And so I think that what we're trying to do is we're trying to engage patients in protecting themselves as we build what we call a wedge of freedom in the healthcare law. So let me just say about patients protecting themselves. So as I say, we tell patients never to fill out these long questionnaires. These are just profiling and data collection questionnaires. You know, you can just say, I refuse, and then when you have a conversation with your doctor, you can decide what to talk about. And because otherwise it's just going to go into your record and it's going to be part of the data collection system. We tell people not to sign the HIPAA form. We have special little wallet-sized cards that they can take in and tell their doctors they're not going to sign the form. And here is the URL to the HHS website that tells doctors what to do when you refuse, because you have a legal right to refuse. When it comes to having a baby, we tell parents, look at getting private screening done. Look on our website. We have a special page for newborn screening and baby DNA warehousing. It's called itsmydna.org. And you can find out how long your state keeps the DNA and whether they do research or not. And then you can decide if you want to do it at the government level or if you want to go get private testing. PerkinElmer is the only place that we know of that does the kind of private testing that parents want to have done. But then it doesn't end up in the hands of the government for them to decide what to do with your baby's DNA into the future. And then we ask patients to have a conversation with their doctor. Ask their doctor about why the doctor is asking them questions like, or whether or not someone else is telling them, the doctor, what treatment protocol to use. When they're on the computer, is the computer giving you only certain choices for treatment protocols? And then tracking what the doctor does and then paying them accordingly. They can ask the doctor, is this your best idea for treating me, or is this the health plans and the government's best idea for treating me? Who are you looking at when you're making a decision about treating me? So they really need to ask these questions and to start figuring out, and actually I think what that does is it brings the doctor back to his or her ethical framework that they know they're supposed to be operating in. They actually want to operate in that. But when they essentially agreed to sign contracts with health plans and they agreed to participate in Medicare and Medicaid, they gave up their autonomy. And now patients have to help them come back to being the kind of physician that they need to be.
Obamacare is an unpopular law in America, and yet Republicans campaigned on repealing it across the country. Why are Republicans not repealing Obamacare?
The reason that Republicans aren't repealing Obamacare is, one, they see the president in the office and they go, this is a waste of our time to push this. But I think politically speaking, they need to push it. They need to put him on record as refusing to repeal it. They need to put him on record as vetoing it. They need all this to be on record. They need all the pressure on the president and all the pressure on the Democrats that put it into place. But my fear is that the reason that they aren't repealing it is because there are pieces of it they might want to keep in place as protection against a political disaster called Medicare. I actually think that the only reason we got to Obamacare is because of Medicare. And were it not for the fact that we have a $43 trillion unfunded mandate called Medicare, we would not have Obamacare. But everyone who's hoping to stay in office realizes that Medicare is a political disaster, and it's going to land on someone's plate unless we have a national health care system, in which case suddenly we don't have a Medicare disaster because all of our money is going into all of the same system and they can just ration it out and ration it away from the elderly and ration it into the young. And so my concern is that the pieces of Obamacare that require more constraints on physician practice, that require more reporting, that really institutionalize the electronic health record, is really something that Republicans are looking at as something to save them from Medicare. But I believe we have to actually repeal piece by piece Medicare. And the reason that I say that is I think that we need to protect those who are dependent on it today, but we need to have a Medicare-free future. I don't ever want to have a Medicare card. I want the young to never have to depend on the government to decide whether they can have health care or not. I want the dollars they put in for all of those years into private health insurance, because we're going to repeal Obamacare and we will have private health insurance back. So all of those dollars that they put in for private health insurance, when they really need them and they get to being elderly, why do they suddenly no longer have access to them? Why at 65 do you lose everything that you ever put into it, and now you become beholden to taxpayers and politics for deciding whether or not you're worth it to get health care? That's wrong. And so we need to protect the people who are dependent on it, but we need to give the young people a Medicare-free future to look forward to.
Is anybody, to your knowledge, doing really effective oversight hearings on the problems of Obamacare as you're describing them and that people are experiencing? And is anybody thinking through how to pull out roots and branches, the Obamacare law and its 20,000 pages of regulations?
I don't think so. And you know, my concern is that, remember how Nancy Pelosi said we have to pass it before we can find out what's in it? I'm not sure that a lot of people here actually know what's in it. And I feel like the focus has been on exchanges and coverage and subsidies, and not on the entire takeover of the entire healthcare system. And by that I mean the doctors, the patients. I don't think that people realize that the whole thing about care coordination and the electronic health record is to make it so that people who aren't doctors can actually just go to a computer and figure out how to take care of a patient because of some outsider's decision of what to put in as a treatment protocol. You know, I don't think the whole height and depth of Obamacare are clear and that people are looking at all of these issues. Some people are going to realize soon that employer-sponsored coverage is going away. I think Jonathan Gruber made that clear with the Cadillac tax. That was the whole plan. We're not opposed to employer-sponsored coverage going away, but because we want people to personally own their health insurance. And we want it to be owned before they're born. We would love for parents to buy insurance pre-born, and then just hand the policy over to their child when they turn 18. And we would never have pre-existing conditions if that were the case. So I don't think that many legislators on the Hill or even around the country know the extent to which President Obama, the Democrats, and all the writers of the law really intended to take over the healthcare system at its root.